Let's talk a bit about RFA. Just introduce the technology.
The term radio frequency ablation means exactly that. It's the same radio waves that you get your music when you're listening to the radio, and they are emitted by antennas. So radio wave ablation needle is basically a little tiny radio antenna. The needle that we use comes to a very fine point, and out of that point comes a low frequency. So when you focus it on a small area like the thyroid, it just creates heat. But it also creates electricity that goes through your body. So we put a couple of pads on your thighs, and those pads are so big that it spreads out the electricity so that it doesn't damage anything where it goes out of your body. When it goes into your body through the needle, it's focused. So we have a complete circuit.
The patient lies down on the table, you numb up their neck with lidocaine, and then you insert that probe into the nodule and essentially burn it. And why is that beneficial?
We haven't really gotten to a thorough description of symptoms of nodules, but if they get big enough, and that usually means upwards of an inch, 2 inches for sure. If they're on the left side, they produce trouble swallowing because that's where your esophagus is. And that can be pretty irritating. A lot of these people, they can't swallow pills. And then on either right or left side, if it's big enough, it can press on your trachea, and that causes a cough. Sometimes there are also positional changes, meaning if you lie a certain way at night, that nodule gets caught between the collarbone and the thyroid, and it presses on the thyroid, and you wake up and you have to roll on your side, or you have to lift your chin up or put your chin down. So it interferes with people's sleep. If your nodule is a couple of centimeters, everybody you run into says, "What's that lump on your neck?" Radiofrequency ablation can relieve all those symptoms I just mentioned in addition to the cosmetic concerns.